Volunteers and city government staff work at the Shuanghe Jing Si Hall to deliver vaccines to local citizens. Tzu Chi sends food and supplies to avert hunger among students attending special refugee schools in Malaysia. I'm Sean Scanlan. This is DaAi Headlines. Let's get started. Digi Jing Si Halls have undertaken the duty of serving as community vaccination stations. Medical workers, volunteers, and public affairs departments have cooperated seamlessly for this very important public health cause. Elementary school teaching staff received the vaccine at the Shuanghe Jing Si Hall. The first such session proceeded very efficiently.
When we see someone finishes registration at a computer and stands up, we stretch out our hands so the person can see us at a glance.
Medical consultation and vaccination are all done in one place, and the waiting time is no more than 15 minutes.
We tell them that they can rest assured. They just have to sit there and don't have to move until they are leaving.
More than 30 volunteers are mobilized every day, and 5,200 people will be vaccinated over 4 days with everything moving smoothly and safely.
Walking into the Jing Si Hall, it feels very solemn and comfortable. We thank Tzu brothers and sisters very much for helping us New Taipei city government, faculty and staff arrange such an environment to administer the vaccine.
A Luzhou Jing Si Hall staff from the New Taipei City Government Secretariat came for the handover.
Because the Luzhou district office has to do more preparations for typhoon prevention, the Secretariat office came to support the Luzhou district office in vaccine administration.
Since most of them focus on internal paperwork, they have few chances to interact with the public, so they came to practice before formal operation. On the day of the handover, there are also deputy commanders and volunteers from the district office to assist.
Our colleagues went back and said that when they came here, they all felt positive energy. Everyone is very kind and willing to give.
10 staff from the Secretariat office participated in vaccine administration for the first time and did their best to serve the public. Indigenous students from Hungkuang University use their free time to learn their ethnic languages. During the pandemic, they have applied these languages in COVID-19 promotions. Take a look.
Indigenous people use their own ethnic language to record COVID prevention videos. Some students wore traditional clothing and others made songs. HKU's Indigenous students utilize their free time to study ethnic languages, applying it to their COVID prevention promotions. Studying at the nursing department, Amish student Ling Xiaoyu recorded videos, sharing helpful tips to her parents and Amish people.
They feel benefited because before they didn't really wear masks, and they also don't know how to protect themselves. Through this video, I wanted to show everyone the proper way to wear a mask.
In the video, different ethnic languages are used, making it easy for seniors to understand COVID prevention methods.
Some seniors living in tribes might not have quick access to COVID prevention information. Through our ethnic language, we may interact with these seniors.
Reminded of their origins, these Indigenous students brought their ethnic languages to use, safeguarding seniors at their hometown.
Due to COVID-19, Taiwan has stepped up the pace of vaccinations with many different vaccine options available. Some do come with side effects and warnings, amongst which is the worry about thrombosis. Follow our report as we learn more.
Because she's in a category that has yet to be called up for a vaccine, she went back with her German husband and 2 children to Germany for summer vacation and the latest vaccine.
On the first day, I feel so in the place where I got the vaccine, and then I couldn't lift my hands up a bit.
Regarding side effects, she was a bit confused and worried like ordinary people as she was given a vaccine which has a potential side effect of thrombosis.
I started to have a fever in the middle of the night, and I felt very cold all the time. because I don't have any chronic diseases and I haven't had any blood problems since I was a child. So if there are any problems and if it's really serious, I will just die. The worst would be continue living and being a burden on my family, which would make them feel uncomfortable.
So far, there have been more than 400 deaths after vaccination in Taiwan. One of the side effects that many fear the most is thrombosis.
When our immune system is activated, it produces antibodies that sometimes may act against our own bodies, such as fighting platelets, which may be mistaken because of the vaccine. This may be related to the ingredients in the vaccine, which may attack our platelets, which can cause thrombosis due to a drop in platelets.
It usually appears in young women. The area that it usually appears are relatively unusual for thrombosis, including our abdomen, our brain, and face.
Emma Koki, executive director of the European Medicines Agency, told the media that a responsible explanation is the immune response to vaccines for rare side effects, including thrombosis.
It is because we produce an antibody against coagulation factor. This antibody has not been proved to be absolutely related to the AZ vaccine so far. So it is only regarded as a warning in the European Union. They are strict regarding the reaction related to the vaccine and whether or not you have produced this antibody with the vaccine.
At present, the rare thrombosis side effects of the COVID vaccine are AC and Johnson & Johnson. The U.S. Food and Drug Administration launched an investigation into 6 cases of blind blood clots after 6.8 million doses of the Johnson & Johnson vaccine in April 2021, reviewing the risk of blood clots being very low as the vaccine is safe and effective.
The fear is the embolism is cerebrovascular. If it embolizes here, it may resemble a stroke. If it is in the internal organs like the lungs, you have difficulty breathing, chest pain, and coughing up blood. If the blood vessels clogged is in our stomach, your stomach will feel very painful with bloating and vomiting.
Current research is unable to determine whether there is a connection between vaccines and thrombosis. In the investigated cases, the number of platelets is very low and there is a specific antibody in the patient's blood that can activate platelets, which cause platelets to aggregate together and form a blood clot. One should see a doctor if the following symptoms occurred 4 to 28 days after the vaccine. The high number of deaths after vaccinations in Taiwan is very much related to the notification system.
If foreign countries report adverse reactions to a vaccine, it must be identified when it is reported. Basically, no, it's impossible for the vaccine to cause death, except for early anaphylactic shock. The domestic notification system basically doesn't have an appraisal system, and as long as it is listed and reported, will be a case. Such an approach will actually confuse the public.
If you are worried about side effects, you can still ask your doctor before the injection and carefully observe your own condition afterwards. The overall vaccine coverage rate must reach 60 to 70% or higher for everyone to safely return to life as normal.
Since the pandemic outbreak, many restaurants have to suspend their businesses. Yang Zhongming, a Digi volunteer who runs a vegetarian catering company, sending vegetarian meal boxes to hospitals, police stations, and fire stations. He sent out 150 vegetarian lunch boxes every day. And his story influenced Digi volunteers overseas. Let's take a look at this amazing story.
At noon, healthcare workers, who have been busily engaged in work for the whole morning, were already hungry. Delicious meals were delivered to the healthcare workers. On this day, it was vegetarian spaghetti, which was so tempting that one could smell its fragrance through the camera.
The taste is also good because the green pepper tastes fresh.
It's quite different from others. It is more diverse.
In the pandemic, he is the one who delivers warm, delicious meals to healthcare workers.
At the very beginning, this tricycle helped us a lot. You can always see it going around in the 101 business district.
You may have seen these tricycle delivering meal boxes in Xinyi district. This gentleman has multiple identities. He is the owner of a trading company, a creative vegetarian businessman, and also a Tzu Chi volunteer.
Back then, Tzu Chi volunteers in Gold Coast, Australia were worried about the pandemic situation in Taiwan. So some volunteers began to think of making contributions.
His story mobilized Tzu Chi volunteers in Australia to donate nearly 2,000 lunchboxes to healthcare workers. The tasty lunchboxes are mindfully made with different dishes every day, and the secret to its delicious taste is here. In the smoke, the fresh vegetables are just finished steaming. This high-end steaming oven, which costs about $18,000, is just used to make lunch boxes. But for his family and the public to eat delicious food, it's worth it.
Using such a high-end oven to steam vegetables is because, firstly, the steamed vegetables are really delicious. Secondly, the nutrition can be locked inside the food.
In fact, Yang Zhongmin not only makes lunchboxes for healthcare workers, he is also a member of a society in Facebook. A few years ago, the society launched an activity to allow the impoverished to eat for free. 130 catering companies responded to it, and Yang Zhongmin was one of them.
It's a Xini meal. We named it like that as some people in need might be embarrassed to ask for a free meal.
Holding the logo of the society, he explained the meaning of the meal. The location of his shop is in Xinyi district, which is near the 101 building. Although it is the prime area of Taipei, there are many people in need.
That is the container she brought for meal. At that moment, I was asking what she wanted to eat.
The scene from the security camera shows a thin woman in her early 60s coming to his shops on July the 16th to ask for a vegetarian lunchbox. She lived in Xinyi district. However, what made Yang Zhongmin feel pity was the gratefulness she sent.
I asked for her line account. After she went back, she sent me a message saying that she was too hungry, that she was about to faint when she came to get the lunch.
The message stated that, "You just saved my life because I felt like I was going to faint." Yang Zhongmin described that the lady spoke decently and wrote well. She looked like an educated person. But now she was so hungry that she was about to faint. It's hard to imagine her story.
Seeing that scene led him to think about many things that cannot be imagined.
Can you imagine such difficult case happened in Taipei Xinyi district? With a successful career and the ability to operate a vegetarian catering company, Yang Zhongmin has trained himself as a social observer and treats people with a passion for food. The fragrant and tempting dishes convey the taste of happiness, spreading blessings to the needy.
Under the movement control order, students in 2 refugee schools in Selangor and Anbang, Malaysia, are facing food shortages. Digi responded quickly by providing them with urgent food and supplies to prevent a crisis. Take a look.
Volunteers joined the ranks to prepare 220 packages of supplies for the 2 Tzu Chi refugee schools in Selayang and Anbang.
We have more than 90% refugee students who are from Myanmar families, as most Myanmar students consume rice as their staple food. We will distribute 2 packs of 10 kilograms rice to each of them.
We took the initiative to ask the teachers to call the students, especially those impoverished ones, to ask if they have come across any difficulties. Later, we found that students from more than 200 households are about to face food shortage.
Refugees' life is not easy, yet it has become even worse because of the pandemic and movement control order.
1 month.
Thank you.
I'm very grateful for the school to distribute food and provide assistance.
If I can't come to collect, our Tzu Chi volunteers will bring it to my home.
To their house. I'm at the parking lot, the parking, a lot of the open parking.
What we are facing now can be regarded as a national crisis. We should not take race or nationality into consideration because basically they are running out of food. Though it's very hot to be wrapped like this, it's worth it.
Apart from Tzu Chi's assistance, vegetable farmers from Cameroon also donated fruits and vegetables to refugee families.
We sometimes eat vegetables, but it's very expensive now. Without jobs, I haven't bought it because it is very expensive.
In the current national crisis, the most important thing is to fight the pandemic. Everyone should unite as one to tide over these difficulties.
In Seattle, a fire broke out in an apartment on July 10th, affecting 43 families. Upon learning of the news, Seattle Digi volunteers immediately provided cash cards, blankets, and toiletries. Here's more.
In the late night of July 10th, 43 families were affected by a fire accident. After daybreak, they became displaced and even the cars at the parking lot were burned down.
We had agencies, probably 5 different agencies responded, and it actually went to a third alarm assignment. So we probably had over 20 different fire department rigs there that night. So, and we were here for probably approximately 5 hours until we had the fire completely under control. All occupancies surged with no fatalities. So that's about all I know about the fire.
My biggest goal right now is to get the families with babies into homes, and I have an amazing organizations helping us, and it wouldn't be possible without Tzu Chi organization helping us, Red Cross helping us. They have done a lot for our families, and I feel like this is one giant community. We've all come together to be a family.
Seattle Tzu Chi volunteers have provided toiletries to residents on July 13th. They've also helped the affected residents apply for emergency assistance. Then on July 18th, they distributed cash cards and blankets to the affected residents.
Thank you for helping us. During this difficult time, we do not have a place to live. Your cash card and food is of great help to us.
On their journey to rebuild their homes, the affected residents have the support of Tzu Chi volunteers.
Thank you so much.
Dr. Cao Wenlong is an authority on dementia at Digi Hospital. His mother passed away at the age of 92. He knelt before his mother's bed and sang his mother's favorite song, Little Sheep is Going Home, as a farewell. And he donated gift money from the occasion of the funeral to do good deeds for his mother. Take a look.
Dr. Cao, folding his hands in prayer for his mother, he knelt by the bed, held his mother's hand gently to say goodbye to her in song. In the afternoon of July 22, Dr. Cao's mother, Fan Yilan, passed away peacefully. She was 92 years old, and her children were by her side when she passed.
You have set a good example to us on taking care of our family and treating our friends with kindness. Thank you, Mom.
The interaction between Dr. Cao Wenlong from Dalian Tzu Chi Hospital and her mother with dementia moved many people. In order to fulfill his mother's last wish, all the gifts of money to the bereaved were donated as a charity for pandemic prevention.
This time, she left suddenly, and we wanted to fulfill her wish. So Dr. Cao said that we donated the gifts of money in the name of our mother.
Lai Junliang, Deputy Director of Dalian Tzu Chi Hospital, made a special trip with volunteers to send care. Dr. Cao's mother had passed away, and there is a bunch of pink roses which was sent by his mother's fans, hanging by the window of the empty room. The bedside lamp was still shining, making people think of his mother's smile.
In Taiwan, after the pandemic outbreak, Ward 9A of Taipei Digi Hospital immediately became a dedicated COVID ward. The nurses were ordered to do their best to treat specially admitted patients. They treated patients like family members, and over the past 2 months, there have been many tears and laughter.
Before going to the dedicated ward, I was in charge of the surgical ward. The average age of the nurse in our unit is about 20 to 29 years old. One of our nurses wrote a sentence saying that our 9A is about to enter this ward, and we will fight it without fear. Then all nurses in 9A cooperate with me to move forward.
这是一场神圣的战役，我们是站在第一线的防疫军。现无形的病毒四窜，我们收起内心的恐慌，与最亲爱的家人们做个短暂的告别，披上白色的战袍，奋不顾身地守在前线。
你平常一天这样子穿梭这套衣服几次？
其实基本上穿进去就尽量就不会再出来，就是大家会轮1到2次这样子。
画个爱心啊，因为有些是年纪很大的，有些看不懂字。
Once I went into one of the wards with Yi Jing, and we showed him how we wrote it behind, and then he laughed. After having such an experience once, I think he will pay attention to the back of nursing staff every time to see if there is writing. He is happy, and we are even happier.
对他们来讲，其实要在里面有笑容不容易，对不对？真的不容易。
It's really not easy because they are facing their health problem. They are also helpless.
也很无奈啊，很无助啊。
When I encountered intubation, I was very scared because there were 3 consecutive patients needing intubation in the ward. At first, we really couldn't understand what the respirator was showing. We asked a senior in the intensive care units to teach us how I should give the patient oxygen and how I should help the patient withdraw sputum with closed suction. These things were something I could not learn in the general ward before. After he taught me, I would teach another nurse, so that it will be passed on. This is what we should do. If we don't do it, no one else can do it.
The younger sister in bed 252 is crying. What's up with her? She misses grandma. Grandma is under intubation. Don't be sad because your grandma started intubation yesterday and is receiving good treatment. Don't think that the virus is spread everywhere. It's not your fault. Yes, don't blame yourself. When we saw her grandma was about to receive intubation, we quickly moved her to another ward. We don't want her to see her grandma behind intubated, so she has been blaming herself since last night.
After everyone knows the story behind the patient, I think the team is gelled and become more united. If we work a little harder and help them a little bit, maybe they will be able to go home every night. I have fulfilled a wish, and I think this is a great thing.
During the pandemic prevention period, students did not suspend their studies, though not everyone has a computer at home. Charity organizations have stepped in to donate laptops and wireless networks. 200 elementary and middle school students in Kaohsiung have benefited from these donations. We leave you with these images. Thank you for watching. Goodbye.